A sacrocolpopexy is a surgical procedure to treat pelvic organ prolapse, a condition in which the pelvic organs, such as the uterus and cervix if present, or top of the vagina if absent, bladder and rectum bulge into the vagina because the muscles of the pelvic floor have weakened. This surgery is designed to return the vagina or the cervix to its normal position. A sacrocolpopexy will be performed laparoscopically in the following way. The surgeon will make 4 to 5 small incisions or cuts on your abdomen. Your abdomen will be inflated with carbon dioxide gas to create enough space to allow the surgeon to see everything. A telescope-type camera and instruments will be passed through the incisions. The surgeon may first remove the uterus if it is still present. Some women also choose to have their fallopian tubes and ovaries removed in order to decrease the risk of ovarian cancer. Next, a piece of surgical mesh will be attached to the front and back sides of the vagina. The mesh is then attached to a ligament covering the lower backbone, also known as the sacrum, which will suspend the top of the vagina or the cervix back into its normal position. If the bladder or rectum are not receiving enough support, or you have urinary incontinence, the surgeon may perform additional procedures through the vagina. When the surgery has been completed, another telescope-type camera will be used to examine the inside of your bladder to make sure it was not injured during the surgery. Your doctor will review the planned surgery with you, and together you can make a decision that is right for you. The day before your surgery, please call the surgery scheduler to confirm your surgery time, check-in time, and parking instructions. Check-in is usually 2 hours before your scheduled surgery. You will be given special soap for cleaning your abdomen and external private parts. Please clean these areas 2 times before the surgery. Do not eat anything after midnight the night before your surgery. This includes gum and mints. Please do not smoke. If you are instructed to do so, you may take your morning prescriptions with a sip of water. You may drink clear liquids like water, coffee, or tea without sugar or cream earlier than 2 hours prior to the surgery. However, if your surgery is moved up unexpectedly, you may be delayed if you drink fluids on the morning of surgery. Your doctor will provide prescriptions that you will need after your surgery, such as medications for pain, nausea, and constipation. After you have checked in at the registration desk, you will be taken to the pre-op unit, where a nurse will perform an assessment and start your IV. From there, you will be taken to the operating room, where you will meet the rest of the operating team, including the anesthesia provider, operating room nurse, and the rest of the surgical team. The team will perform a safety check, which will review the planned surgery. The surgery will take 2 to 5 hours to complete. When it's finished, you will be taken to the post-anesthesia care unit, or PACU, to wake up from anesthesia. You will stay there until the anesthesia wears off, which can be different for every person. A voiding trial will be performed to see if the catheter in your bladder can be removed prior to going home. The bladder will be filled with saline and the catheter will be removed. If you are able to void 2/3 of the volume placed in the bladder, you will be discharged without a catheter. If you are unable to adequately empty your bladder, the catheter will be replaced and a nurse will teach you how to care for it. A follow-up appointment will be scheduled in 3 to 5 days for a repeat voiding trial. Another option is that you can be taught self-catheterization prior to going home, and this may be performed 3 to 6 times daily until you are voiding sufficiently. Once you have recovered from anesthesia and are able to eat, drink, and walk, you will be ready for discharge from the PACU. Your PACU nurse will review discharge instructions with you and your family. You must have a driver who is at least 18 years old to take you home. If your caregivers have any concerns about your surgery, you may need to stay in the hospital overnight for observation. Get plenty of rest after the procedure. A responsible adult should stay with you the first 1 to 2 nights after you get home. Some patients may have side effects from the anesthesia. This includes sleepiness, confusion, nausea, and vomiting, which can last up to 24 hours after surgery. You may have gas pain, abdominal swelling, or shoulder pain for 24 to 72 hours after surgery because of the gas used to inflate your abdomen. A warm shower, heating pad, walking, and chewing gum may help with any discomfort. For the first 24 to 48 hours, you should alternate taking ibuprofen with food and acetaminophen every 6 hours, as long as you have no medical reasons preventing you from using it, and the providing narcotic medication as needed for more significant pain. After the first 2 days after surgery, you can take the ibuprofen as needed for pain. The narcotic pain medications can sometimes cause constipation. You will be given a prescription for medications to help reduce your chances of becoming constipated. You should start taking these on the day of your surgery and adjust them to achieve an acceptable stool consistency. For example, the Miralax in 4 to 8 ounces of fluid should be taken daily in order to improve constipation. You may increase or decrease the dose as you need, but daily intake is important for successful bowel movements. You may experience softer stools than desired or gas pain, so you may want to decrease your dose. At home, you should drink plenty of fluids and eat bland, low-fat foods such as crackers, Jell-O, and chicken broth. Try to avoid fatty food, which can cause nausea. You can gradually expand your diet as tolerated. We recommend that you walk carefully around the house to exercise your calf muscles and prevent blood clots from developing in your legs. You should go slowly on the stairs and use the railing, especially during the first day after surgery. To prevent your lungs from becoming infected, your caregivers will give you a breathing machine called an incentive spirometer. You should use this device every hour to take deep breaths for the first several days after your surgery. If you are discharged home with a catheter, be sure to empty the bag before it gets too full. Keep the catheter tubing free of kinks and the Foley bag below the level of your bladder. Keep your pubic area and catheter tubing clean. You may want to tape the tube to your leg so that it's not accidentally pulled out. It is normal to have a small amount of bleeding or discharge from the vagina after surgery. This may last up to 6 weeks. If the bleeding is bright red and in large amounts, please call your physician or doctor on call. Recovery from surgery usually takes 2 to 4 weeks, but sometimes longer if you want to do more strenuous activity. It is normal to be very tired during this time. You may shower the day after your procedure, but do not swim or soak in water for 6 weeks after your surgery. Do not put anything in the vagina for 6 weeks after surgery unless your doctor tells you to. This includes tampons, douching, and sexual intercourse. Do not do any heavy lifting, pushing, or pulling for 4 to 6 weeks. Do not lift anything more than 5 pounds, such as laundry, groceries, children, or pets. Do not do any vacuuming, and do not push any heavy doors or grocery carts. Do not drive for approximately 2 weeks after surgery while you are taking narcotic pain medication or until you feel that you are ready. You may have 4 to 5 incisions on your abdomen, which will be closed with either glue or steri strips. Keep the incision clean and dry. Stitches are placed underneath the skin and do not need to be removed. You may remove your steri strips 5 to 7 days after discharge. Wash your hands often, especially before touching your incision, changing any dressing, after using the restroom, and before eating. Call your doctor if you have any of the following happen. If you cannot urinate for 3 to 5 hours, or if you can only urinate small amounts. If you develop a temperature of more than 100.4 degrees Fahrenheit or 38 degrees Celsius or chills. If you have problems with your incision such as redness, warmth, swelling, or foul-smelling drainage. If you develop severe nausea or persistent vomiting. If you have bright red vaginal bleeding and you are soaking more than 1 pad an hour. If you have foul-smelling vaginal discharge. If you have severe pain that does not get better when you take pain medication. If you develop pain and swelling in your legs, especially if it's only on one side. If urination becomes painful or if the urine becomes cloudy or foul-smelling. We will give you a phone number to call if you develop any of these problems after your surgery. If you have any questions, please ask one of your caregivers. Thank you for choosing Cleveland Clinic for your care.